Mary Tran, and this is my patient Deandra Stewart. Today we're going to do 2 passive and 2 active stretches in order to help her with her lower back problems. So first we're going to start with active stretches, but before we start I need to mention that all these exercises are taken from the ACA. So Deandra, go ahead and lay face up for me. First, the first active stretch we're going to do is a piriformis stretch. So I want you to go ahead and have your legs down, and go ahead and bend your leg right here. And what I want you to do, grab a hold right here and try to bring it towards your chest. And my patient should feel a nice stretch in her glutes. And she will hold this for 30 seconds, and then she'll put that down, and it will repeat on the other leg. 3 to 6 times on each leg, 1 to 2 times a day. Next, what we're going to do is another active stretch, and that's going to be the back stretch. So patient is going to lay face down, and she's going to have her arms by her side. And patient, I want you to go ahead and push yourself up like you're doing a push-up, and look just straight ahead. And what that's going to do is release some pain in her lower back. And she's going to hold this position for 30 seconds, and she can do this several times a day. Next is we're going to do some passive stretches. So patient, you can still go ahead and lay face down for me. And what we're going to do are leg raises. So patient, go ahead and take your left leg and lift it off of the floor 1 to 2 inches, and then put it down. And then on the right side, do the same thing, and then put it down. And so what the patient is going to do is alternate each side, 20 times each side, several times a day. And what we're going to do next is patient, go ahead and lay face down with me. And what we're going to do is an exercise called bridging. And what bridging is going to do is going to help activate that core of hers. So patient's going to lay face up, and then her knees are going to be bent, feet are on the floor, hands are by her side, and what I want you to do is go ahead and bring your pelvis off the floor, and she has a nice angle right here, and then back down. And patient will repeat this for about 20 times, several times a day. And so those are your active and passive stretches.
And we're switching spots right now. My name is Deandra Stewart. I'm a chiropractic intern here. And what we also want to talk about is lumbar facet syndrome, and how you can see if it's getting better by looking at the KIMS test. KIMS test is going to be negative for lumbar facet syndrome, but you're going to have a classical significance on KIMS on extension. So we'll do the KIMS test on extension after we've done the exercises for, let's say, a week. We should see that the pain is decreasing or is no longer there. Another way to look at to see if lumbar facet syndrome is decreasing and the patient is getting better is looking at lumbar flexion. Lumbar flexion is opening up the vertebrae, and so when they initially start, they should have some issues in terms of flexing their lumbar region. However, you should see a substantial difference in lumbar flexion as the patient improves. So thank you so much. Have a great day.